Dr. Murphy, Sue, team here at Morrilton, this is a really exciting time. I am a pediatrician. I've taken care of families for a while. Let me just say, I have never met a mother or a father who wants a healthy, uneducated child or an uneducated, unhealthy child. They want an educated, healthy child that we deliver for the rest of their lives. And you are entrusted with those kids more than any other adult group is for helping make that happen. And yet, historically, we've had our health system and our education system split and not really working together. We've had some outposts, school nurses, others that have been in the school system. We've had a fewer set of outposts in the healthcare system, worried about the education piece, but we've got to bring them together. And Dr. Murphy alluded to this new threat of the epidemic of childhood obesity. This was not around 30 years ago. 30, 40 years ago, the most kids that we had was about 5% that had a weight problem. Now we have 20% that are defined by the Center for Disease Control in your school as obese, and another 19 or 20% that are overweight and at risk of becoming obese. As you'll hear today, and others will share with you over time, it's not just how you look. It's about what it's doing to your body. It's getting your body out of balance. It's making your body work harder. It's having your balance lead to adult conditions like type 2 adult diabetes that we're now seeing in 12, 13, 14-year-olds. Hypertension that we're now seeing as early as 8 years old. These are adult conditions that are caused by your body being out of balance because you're carrying too much weight around. Now, whatever path you want to get to the Creator, our brains are an incredibly powerful and complex. And I think anybody who's in the clinical world, and I feel confident anybody who's in the education world, is constantly amazed at what our young kids' brains are capable of doing. But one thing that we all are programmed to do is get prepared for the next ice age. Okay? We are worried that we're not going to have enough food at some point in time, even though around us food is ever more plentiful. And so when we take in too many calories and we don't burn off enough calories, our bodies get ready for the next ice age and we put on pound, sometimes 1 pound, sometimes 2 pounds. Now, I want to do a little exercise that I have found work. Now, you're a younger crowd, so this may not work as well as if I had an older crowd. So Governor Tucker, I may have to call on you and a few others here if the questions don't work for folks. All right, let me see a show of hands of how many of you walked or rode your bike to school when you were a kid. All right, I've got almost everybody. Let me see a show of hands of how many of your kids or grandkids walk or ride their bike today. 4, 5. All right, let me ask, how many of you ate out more than twice a week when you were a kid? I've got 1, 2, 3. How many of your kids or grandkids eat out more than twice a week today? Okay. How many of you watched cartoons on Saturday morning when you were a kid? This is my question that may not work. When I was a kid, there were only 3 stations. And they went off the air, and the Indian came on at 11 at night, and the Indian went off at 6 a.m. on Saturday morning, and we got up to watch cartoons. Now, how many remember, I just needed a denominator to know who's going to be able to answer that. Who remembers the Indian? Okay, all right, this will work. All right, so you had 3 channels on cartoons, and at noon, the cartoons stopped, right? And you got turned outside to go play for the rest of the day. What were the 3 shows that cut the cartoons off? Mutual of Omaha Wild Series, Wide World of Sports, Congressman's got it, the skier who falls off coming down the slope. One more. Come on now. No, that's during the week. That's during the week. America Bandstand. Right? And you would be turned outside. And how many of y'all were put out on Saturday afternoon? As long as you were home by dinner, it was okay. How many of you would let your kids or grandkids out of your sight more than an hour? Okay, everything we just talked about tipped that balance. More calories, less burning it off, more pounds. We've got to learn healthier habits. We've got to take more protections of our children. We've got to engage with our families. We have to make education about health be as important as education about math, because your health is going to be with you for the rest of your life. And we're excited at our center because we've tried lots of things across the state over the last decade and a half. We've tried school gardens, which have shown an effect. We've tried physical activity, which have shown an effect. We've tried improved nutrition that's shown an effect. But we've never done a full court press. And you in Morrilton, in this school, are going to put a full court press on, and I believe become the model for the state and potentially the model for the nation of how to safeguard the future health, productivity, enjoyment of the kids that are in your care now. We look forward to being with you. Tony Gowdy on our team is going to lead some of the evaluation efforts. We're your partners. Tell us what you need, and we'll be glad to be here. Thank you for having us today.